Here at THV 11, we are working to save a generation, educating you about the drug addiction crisis and sharing stories to help end the stigma. A brain surgeon at CHI St. Vincent in Little Rock is seeing the devastating effects of this epidemic firsthand. Dr. Ali Krish is the director of the Arkansas Neuroscience Institute at CHI St. Vincent in Little Rock. It's here in the OR where he spends most of his day.
On average, we do about 10 to 15 a week.
A distinguished neurosurgeon with 30 years experience, he's operated on patients from all around the world. Recently, though, he's noticed an alarming trend.
Recently, I've seen more and more young patients presenting with hemorrhages, bleeds in the brain, that normally you don't see in a younger age group. You usually have 1 or 2 patients every 3 to 4 months. But all of a sudden, we have 2 to 3 patients within 1 week.
Dr. Krish says those bleeds, which typically occur over decades in older patients with high blood pressure, are the direct result of drug abuse in adolescents and young adults.
The youngest I have seen is 22 years old, and this is very young. What happens in these patients is the process that takes 20 to 30 years is happening within a year or 2.
Dr. Krish says if these patients do survive, their quality of life is diminished.
You may never be able to speak or never able to walk without assistance.
Dr. Krish says his concern isn't only for the patient, but for the loved ones who may be using as well.
I address all the people around them because, unfortunately, this usually happens in groups, not only as one individual.
A devastating and sometimes deadly consequence of an epidemic Dr. Krish is seeing firsthand.
It is devastating.
Dr. Krish says he's seen patients who are using meth, cocaine, and heroin, but he also says marijuana has similar effects, and he cautions that with marijuana becoming legal in a lot of states, he's concerned that these cases will grow. There's times he's had to stop actually in the middle of surgery because the brain is so swollen from marijuana use that he has to close back up and then redo, go work on the surgery again the next day.
It's unbelievable what they're discovering now with the advances in medicine and science, that they can actually see the effects of this.
And this is unbelievable because this is something that should happen to your brain, as he mentioned, over decades, 30 to 40 years, and he's seeing 1 to 2 years that's happening in patients that are 22 years old. That's terrifying, and their quality of life, as he mentioned, diminished after that. You don't have a life if you do survive it.